Classification of malocclusion introduced by Edward Engel. Engel classified malocclusion on the basis of anterior-posterior relationship of the teeth. Engel classified malocclusion into three types: type 1, type 2, and type 3. Type 2 is further divided into class Engel's class 2 division 1 malocclusion, Engel class 2 division 2 malocclusion. Engel's subdivision is further divided into Engel's class 2 subdivision division 1 malocclusion, Engel's class 2 subdivision division 2 malocclusions. Engel class 3 is further classified into true class 3 malocclusion, pseudo class 3 malocclusion. Mesobuccal cusp of maxillary permanent first molar occludes with the mesobuccal group of the mandibular first permanent molar. There are extraoral features and intraoral features of Engel's class 1 malocclusion. So extraoral features of Engel class 1 malocclusion is facial profile straight, facial divergence straight, lips are competent. Intraoral features of Engel's class 1 malocclusions are spacing in arch may be present. Additional features: crowding, spacing, rotation, missing tooth, bimaxillary protrusion, midline diastema are seen. Engel's class 2 malocclusion is characterized by class 2 molar relation, where the distobuccal cusp of maxillary permanent first molar occludes with the buccal groove of mandibular first permanent molar. Now we'll talk about the further classification of Engel's class 2 malocclusion. Engel's class 2 div 1 malocclusion is characterized by class 2 molar relation on either side with proclined maxillary anterior. Features are deep incisors, overbite, abnormal muscle activity. The upper lip is usually hypertonic, short, and fail to form lip seal. V-shaped upper arch. Hyperactive mentalis activity. Engel's class 2 div 2 malocclusion is characterized by class 2 molar relation with retroclined maxillary anteriors. Features are lingually inclined upper central incisor, labiously tipped upper lateral incisor, deep anterior overbite, jet decrease. If the class 2 molar relation on one side of the arch and class 1 molar relation on the other side of the arch with proclined maxillary anterior is termed as Engel's class 2 subdivision division 1 malocclusion. If the class 2 molar relation on one side of the arch and class 1 molar relation on the other side of the dental arch with retroclined maxillary anteriors is known as Engel's class 2 subdivision division 2 malocclusion. Engel's class 3 malocclusion is characterized by class 3 molar relation where the mesobuccal cusp of the permanent maxillary first molar occludes into the interdental space between mandibular first and second permanent molar. This is a skeletal class 3 malocclusion of genetics. The lower incisor tends to be lingually inclined, thus the tongue occupies a lower position, resulting in narrowing upper arch. This type of malocclusion produced by forward movement of mandible during jaw closure. Thus, it is also called postural or habitual class 3 malocclusion. Basically, occlusion is not actually class 3, but patient places teeth in such a way it looks class 3 malocclusion. There are few causes of pseudo class 3 malocclusion. Presence of occlusal prematurities made the mandible forward. In case of premature loss of deciduous posterior, the child tends to move the mandible forward to establish contact in the anterior region. A child with enlarged adenoids. This is a condition characterized by class 3 molar relation on one side and class 1 molar relation on the other side. Engel's classification does not classify malloc transverse and vertical plane. Engel's classification cannot be applied to the deciduous dentition. Engel's classification cannot be applied if the first permanent molars are missing. Engel's classification does not differentiate between dental and skeletal malocclusion.